if we prevent RSV now with these monoclonals and maternal vaccine, and we have a pneumococcus vaccine, the potential to reduce all the morbidity and mortality associated with pneumonia will be important. If you look at the World Health Organization, the target to decrease pneumonia is #1 priority. A few years ago, diarrhea and malnutrition used to be the big killers. We did very well with rotavirus vaccine, with oral rehydration, and now we are working on norovirus vaccine. The big challenge for pediatric health is respiratory infection, pneumonia. And the two big players are RSV and pneumococcus. We have pneumococcus vaccines. Now we are beginning to have prevention of RSV with monoclonals and maternal vaccines. So this is really, really, really important, because I think we are going to be able to reduce all this morbidity, hospitalization, and deaths. Even if we can dream, we know that RSV also facilitates ear infections. So maybe we can even have an effect, we will see, there. And again, if we reduce ear infections, we also decrease antibiotic usage, right? So the benefit of prevention with vaccines, monoclonals for RSV and vaccines for pneumococcus could be really significant across different levels of morbidity in children. Maybe the people have not heard too much about RSV, but the people have heard about bronchiolitis. And if they have a cousin, a friend, or something, they will think about this. And I see that so far, the real world evidence that both the monoclonals with nirsevimab, and I expect the same thing will be with clesrovimab, will be really well accepted, because the families want to protect the babies. Same thing, maternal vaccines. Pregnant women will do whatever it takes to protect the baby. And to me, that's sometimes an easier conversation one-on-one in these very young babies than maybe with other vaccines that we give to older kids. Now, this is a really hot topic. And I feel that sometimes the message that we talk about vaccines have been a little bit too simplistic. We need to be able to engage them in a more detailed and sophisticated conversation. My experience has been that when they tell you they don't feel the vaccine is good for them or whatever, we need to try to make an effort to understand really what is the reason. And sometimes you cannot address the complete answer in one session, but when they come back to the clinic and you continue that conversation and that ideas that you explained carefully the first time, they come up and say, well, now I've been thinking and I'm more open to get the vaccine. So I think that understanding their questions, understanding their concerns well, and explaining also how the vaccines work in detail, and the nuances. For instance, a flu vaccine could work 60-70% to prevent flu, right? But can prevent 90% of hospitalizations. Measles vaccine is 95% effective or 98% effective. So I think distinguishing how good the vaccine is, what are the expectations, and what is the disease that we are trying to prevent is very, very important.